there comes a point where a person's life. Oh, let me say that again. There comes a point where a person has no care, and that is why the doctor has considered them terminally ill. My opponent said that this proposal would be abused. Let me get that real quick. That they'll be at the risk of being abused. And to date, persons who have chosen to use the Oregon Death with Dignity Act law have been well educated and have had excellent health care, have had good insurance, have had access to hospice, and have been well supported financially, emotionally, and physically, which shows that it'd be less of a risk because of their education. They also talked about how it's a person's right to die. The right of a competent terminally ill person to avoid excruciating pain and embrace a timely and dignified death bears the sanction of history, and it's implicit in the concept of ordered liberty. The exercise of this right is essential to the person's autonomy and bodily integral rights. Safeguards by the court's decision relating to this marriage, family relationships, procreation, contraction, child rearing, and refusal of termination of life-saving medical treatment. In particular, this court's recent decisions concerning the right to refuse medical treatment and the right to abortion instruct that a mentally competent, terminally ill person has a protected liberty interest in choosing to end intolerable suffering by bringing about his or her own death. My opponents also stated that they wouldn't have suffering at the end of their life because we have pain medication. Americans, which is not true. We don't go through what they're going through, and there comes a point where pain medication doesn't help at all. Americans should enjoy a right guaranteed in the European Declaration of Human Rights, the right not to be forced to suffer. It should be considered as much of a crime to make someone live who with justification does not wish to continue as it is to take life without consent. My opponents also talked about they also talked about the killing of babies and how that the law would actually allow this. And actually, we stated before that euthanasia is illegal worldwide, but just decriminalized under specific circumstances in the Netherlands and chronological protocol, which is showing that we wouldn't be doing that proposal. I'm going to talk to you guys about some statistics on euthanasia in the Oregon State Law Act. And since 1998 to 2009, 244 males have proclaimed euthanasia. That's 22 males a year. And 216 females, or 19 females a year, have proclaimed euthanasia, which is also more statistics showing that people would not take this into abuse, and the guidelines to get euthanasia is really tough. So I'm also going to talk about how the value of life as patients approach their death. Life itself is commonly taken to be a central good for persons, often valued for its own sake, as well as necessary for pursuit of all other goods within a life. But when a competent patient decides to forego all further life-sustaining treatments, then the patient either explicitly or implicitly commonly decides that the best life possible for him or her with treatment is of sufficiently poor quality that is worse than no further life at all. Life is no longer considered a benefit by the patient, but has now become a burden. The same judgment underlies a request for euthanasia. Continued life is seen by the patient as no longer a benefit, but now a burden, especially in the often severely compromised and debilitated states of many critically ill or dying patients. There's no objective standard, but only competent patient's judgment of whether continued life is no longer a benefit.